Well, as Mumbai opens up, there is a worry that there will be a spike in cases and a greater requirement for beds. The government has acquired 80% of beds in private hospitals, and to enforce the orders, a panel of IAS officers has been set up as well to look into the workings of private hospitals.
These private hospitals will now have a nanny, a government official. They will have to ensure that government rules are being followed in 80% beds, charges are as per rates fixed by the government, and hospitals update real-time bed and vacancy data and not deny admission to patients. The government's move comes after Health Minister Rajesh Tope visited hospitals last week and found lapses, like status of beds not being displayed, charges not being displayed, and refusing admission to patients.
कई उसमें कमियां हैं इम्प्लीमेंटेशन में, जैसा कि वहाँ पर बोर्ड लगाया गया नहीं है, चार्जेस का बोर्ड लगाया गया नहीं है और कुछ पेशेंट्स को वहाँ पर बेड्स उपलब्ध नहीं किया जा रहा था। हमने वहाँ पर बेड्स तो उपलब्ध किए, लेकिन उनको हमने नोटिस भी जारी किया है कि एक शोकॉज नोटिस है कि ये हम बिल्कुल सहन नहीं करेंगे।
There were a lot of hospitals which were not following it up. That's why we have nominated the IAS officers and we have given the numbers of hospitals under their jurisdiction.
Private hospitals are keeping mum on the issue for the time being, but private testing labs may have a breather. In an effort to make testing easier, the BMC has changed testing guidelines. Now, direct and high-risk contacts of confirmed COVID-19 patients can be tested between day 5 to day 10 of exposure without prescription. If they develop symptoms before day 5, they can be tested without prescription. Mumbai has a huge shortage of ICU beds, and that's one of the key reasons why so many deaths has been reported. The government wants to keep the death rate low, which is why the focus is now on patients who require critical care so that they don't die because they don't get admission in a hospital. In Mumbai, Saurabh Gupta, NDTV.